Visiward is an at-a-glance patient status board solution linked live to the hospital main patient information system. So the patient population across the entire organisation can be viewed in a single and consistent manner, and it can be viewed from any location, wherever you are.
The minute a patient does land on a ward, that patient is immediately displayed on the electronic whiteboard, which is obviously very timely and effective.
Before we had Visiward, we would actually take the patient's details, write it on a whiteboard.
It's just more difficult to see when it was on a whiteboard, and it could get rubbed off easily, and it just wasn't very clear.
Sometimes the information written on the handwritten whiteboard was inaccurate.
We find this board extremely useful. It allows me to see where all my patients are at any one time, and in particular, from my point of view, I can see when each individual EDD, estimated date of discharge, is for each patient.
It gives you access to other wards, so if we have inquiries either via telephone or people actually coming onto the ward in person, rather than ringing around every ward, which is quite time consuming, we can actually just look on the Visiward system and see where the patients are.
We know that a patient is on a particular ward, on a particular site and in a particular bed. The bed managers will be using the tool because not only do we have the plasma on each and every ward, we also have the web application. So any consultant in the comfort of his own office will be able to have a look at the web application and identify where his patients are.
If you think about the power of Visiward across the NHS, the challenge I would put out that Visiward supports is how quickly can you query across a trust, across a hospital, the live patient population and the capacity of that hospital or that trust. And what we're doing with Visiward is making that instantaneous. So you can move around an organisation and quickly find out where the beds are, where the patients are, and use that to really help improve the processes around patient flow.
When a patient arrives on the ward, they can clearly see the room and bed allocation, but also the expected date of discharge. And again, they know that the patient is in good hands, and the people involved in the care, they are planning the discharge right from the admission.
It's actually been quite easy to learn. I'm not exactly IT literate, however, it's been quite easy to use.
Visiward is quick and easy to use. It's intuitive, so you don't have to have a complex training program to use it. Users can instantly become familiar with the screen and what the icons mean. It automatically updates in real time, so you don't have to train people to go and interact with the software at all. In the design process of Visiward, we engage with a real cross-section of the user community. We sat down and talked with midwives, with doctors, with ward clerks, ward managers, to really ensure that we got their feedback and their buy-in to the process.
It's definitely been a triangle. There's been the CSC, there's been the IT department in Pennine, and there's also been major clinical engagement from staff nurses, ward managers and senior clinicians.
The challenge from now with Visiward is we've really set some excitement amongst our user community as to the potential future features of the software. So for me, that's about clinical engagement. So as a clinician visiting a ward or visiting a patient care area, what information do I also want to see at a glance? The possibilities really are endless in terms of where you could go next.